Hello, good afternoon, everyone. Myself, Dr. Lokesh Gautam. I'm a physician working in a Greenfield, Faridabad. Today, on the occasion of the World Hepatitis Day, I would like to tell you a few important things. First of all, I would like to tell that the hepatitis it means the inflammation of liver. Whenever there is any injury or any cut to our body, there is a swelling of that area. That is called inflammation. And when the inflammation occurs in liver, it means there is hepatitis. So एक आम भाषा में बात करें, hepatitis means liver का infection. So there are the 5 types of hepatitis virus, which affect the liver: hepatitis A, B, C, D, and E. Out of them, the hepatitis A and E, these two are transferred by the contaminated water or outside contaminated food. And the other viruses like hepatitis B, C, and D, they are mostly transferred by the contaminated blood or by sexual transmission. So, likewise, if we're talking about India, in India, hepatitis is an endemic disease. And especially if we're talking about Faridabad, in Faridabad, hepatitis is also endemic. So, what happens in hepatitis? There is a jaundice, there is a yellowing, discoloration of body, yellowing, discoloration of the tongue and sclera, eyes becomes yellow, and the patient passes dark yellow color urine. And there are other symptoms also. There is a fever, there is a loss of appetite, there may be some headache, body ache, and sometimes there are vomiting with abdomen pain, and sometimes there is only nausea. So these are the some symptoms, and also there may be some other symptoms that can be present in hepatitis, like sometimes there may be diarrhea in hepatitis. So generally hepatitis occurs cause I tell you, and symptoms and also elaborate. And now I would like to tell about some few do's and don'ts. And treatment of hepatitis is very simple. If we like to treat hepatitis, then what we have to do? Just generally, first of all, if we would like to avoid hepatitis A and E, then stop contaminated food, stop outside food. That is very important, especially in rainy season. And if you want to avoid hepatitis B, C, and D, then in that case you have to avoid especially sexual transmission. So if you have to use barrier if you don't know the status of your partner. Likewise, there are some other do's and don'ts, like if you have hepatitis, then you have to take sufficient rest, you have to eat balanced diet, and you have to take adequate water, take proper rest, take a balanced diet, and you have to take medicines. Especially you have to take oral sweet drinks, like you can take Glucon-D. That is very good in removing jaundice from your body. And to prevent the infection of hepatitis B, you have to cover your wounds. If you are any drug user, or if you are using any needles, IV needles, then they should be hygienic. You don't have to share your needles and razors for prevent hepatitis B, C, and D. And also, if there is a pregnancy, if there is a pregnant female, then in every pregnancy you have to got test for hepatitis. And so these are some do's and some don'ts. That don't use any personal items, especially in the items which can carry infection from one to other. And don't share your razors, your toothbrush, your syringe and needles. Don't donate blood. And also, if you're a mother, then if you're hepatitis B positive, then you can breastfeed your child, but you have to take certain precautions. Also, you have to you have to avoid alcohol if you want that your liver becomes healthy in good time. And also, the medicines which can affect liver badly, you have to avoid the medicine. Like you have to avoid some medicine like acetaminophen and other, especially NSAIDs. And also, don't eat and drink contaminated food, and especially contaminated water, mostly in the rainy season. Thank you.